This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning, everybody. Mon Health Talk. I am Sarah Giosi. Dave is out, which is especially unfortunate today, I think, because we have in studio with us Dr. Shakuri-Rad, urologist and medical director of robotic surgery at Mon Health Medical Center. And we're going to be focusing on men's health, which not my area of expertise. I'll be honest about that, but that might be good because I can ask some questions that are really basic then that maybe will help our listeners. So good morning.
Good morning, and thanks for having me today.
Yes, thank you for coming in. Now, why don't we start out first? Let's just put a little bit of a personality behind you here before we start talking about your specialties. Tell us a little bit about yourself. Where are you from?
So I actually graduated from Parkersburg High School, and my wife and I both went to PHS and came to WVU for undergraduate studies, where I graduated in chemistry and German, and we moved on to Lewisburg, West Virginia, where I attended WVSOM for medical school, and moved on to Michigan, Grand Rapids, Michigan, and did my residency in urology there, and did my training in robotic surgery. And
like so many of us, you boomeranged, you came back.
Absolutely.
And now here you are.
Absolutely. We're very happy to be back home.
Yes. Well, we're happy to have you. And again, you are working over here with our lovely Mon Health systems, and you're performing robotic surgeries, which in and of itself I find completely fascinating. And not something, I mean, this is obviously a lot of new technology and something that I think a lot of people just don't know much about. Can you just tell me in general a little bit about what that even means?
Absolutely. So robotic surgery is essentially advanced laparoscopic surgery, where we took a minimally invasive surgery to the next level and are able to perform more delicate procedures on patients and get them home faster, get them to recover faster so they can be with their loved ones a lot sooner than they used to be.
Yeah, isn't that wonderful? Again, the modern science and the modern technology and how it's helping us get home sooner, that is huge.
Absolutely. Technology is advancing at a rapid pace, and it has affected medicine as well. And I think we're going to see some great things happen here in the near future.
Yeah. Now, as we talk about men's health, what is, would you say, the biggest thing that you're sort of focusing on?
So given that I focus on robotic surgery, I do focus on men's oncology and urologic oncology, and that includes prostate cancer, kidney cancer, bladder cancer, and everything in between. But I also focus on overall men's health and whether it being urinary symptoms, kidney stones, or erectile function. I focus on various different things that are very important to men, and men in general don't like to talk about those things.
Yeah, you know, and we have this with women's health issues too. This is just, in general, anything that has to do with gender issues, I think sometimes we can get really sensitive because it's really private.
Absolutely.
Or we grew up believing it was really private, even though, you know, it's body parts that we all have. So it's okay to talk about it. And we'll not get into areas that are too uncomfortable for people today, but it's really important to know your body and to be speaking to your doctor at the very least about any signs or symptoms, and we'll talk about what some of those are today, that you may see. You should not be ashamed or embarrassed when you go and meet with your doctor. That physician is there to help you specifically with these issues, right? Can you talk about that just a little bit?
Absolutely. And I think it's very important to have that patient-physician relationship and be able to open up and talk about intimate things, because sometimes those intimate symptoms that patients are experiencing have actually some more global health issues associated with them. And it's important to mention everything that's bothering a patient when they come in. And those symptoms can also affect their daily life, their quality of life. And we definitely want to focus on helping them with those symptoms as well.
Absolutely. And I think sometimes whenever we go in, we think, well, I'm talking with a very specific doctor who specializes in very specific things, so I shouldn't mention all of these other things happening. But it's amazing. I mean, we're one system here, so it all works together. Is it important for people to tell you kind of maybe not everything, but a lot of the symptoms that they have holistically happening within their body?
Absolutely. So I did go to West Virginia School of Osteopathic Medicine. As an osteopathic physician, we have a holistic viewpoint on patient care, and we have the three things that we focus on. It's the mind, body, and the spirit. And the body is only one of those things. The mind obviously plays a big role, the spirit of the patient and how they define that. So when a patient comes sees me, I don't focus just on the one specific symptom they tell me about. I ask them about everything else as well, because the body is a unit, and we have to focus on the patient as a whole, not just on individual body parts.
Absolutely. All right. Well, let's fit in our first break here so that whenever we come back, we can have a good, lengthy discussion. We're going to talk about prostate cancer next, which again, it's a heavy topic, but I want everybody to stick around. It's a really important topic. And we're really going to get into what some of those signs and symptoms are, what treatment options are, and why it's important for people to know all of this. So we'll do that next. Again, we are speaking with Dr. Shakuri-Rad, Mon Health Talk Radio.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
Good morning, everybody. We are back with our Mon Health Talk Radio on WAJR. I'm Sarah Giosi. Dave Wilson out today. He'll be back Monday, and then he'll be in and out here over the next couple of weeks. But I am joined in studio right now with Dr. Shakuri-Rad, and we are talking about men's health today. And I want to switch gears a little bit. We got some really great history, some of the, sort of the fundamentals of you. But now I want to talk really specifically about prostate cancer. And this is something, and I'll share, it's something really important in my life. My grandfather actually passed away from prostate cancer. And we were kind of talking about this a little bit last segment. I think that there are some real taboos around talking about things. I'm sure he had symptoms that he just never shared with anyone. And so it's really important for us to, let's just talk a little bit about what prostate cancer is. And then let's share some of those symptoms and ways that, you know, our listeners can start to reach out to get some support.
Yeah, so prostate cancer is the second most common cancer in men after skin cancer. And so it is very, very prevalent in the U.S. and worldwide. And it is something that we have focused on and tried to promote screening for. And we have done some great work in urology. And since the mid-90s, we have actually reduced prostate cancer deaths in the U.S. by about 50% using the screening methods that we have available today.
And talk to me about the screening methods, because there was actually a big change, right? And this is really important to why we've seen that I guess those statistics change so much.
Exactly. So in 2012, the U.S. Preventative Service Task Force released some guidelines recommending against prostate cancer or PSA screening. And the way that impacted urology and prostate cancer care specifically was rather significant. And I think we need to take a minute to talk about what the USPSTF is and how they decided on their original recommendation. Now, this panel is a panel of 16 volunteer members who are experts in preventative and evidence-based medicine. They include family physicians, internal medicine physicians, OBGYNs, pediatricians, and nurses. And unfortunately, they didn't have any urologists or oncologists on their panel to assist them with these recommendations in 2012. And since then, we started seeing multiple studies surfacing showing a rise in advanced and metastatic prostate cancer in the U.S. This past year, the panel updated their recommendation and now advises shared decision-making between the patient and the physician, which is always the best way to go forward.
Absolutely. That's kind of amazing to me that's more of a modern conversation, frankly. You know, that's really great. But again, what a huge change that is now helping to save so many lives.
Absolutely. And given that the statistics are so high, and we're talking about the second most common cause of cancer in men, this is something we definitely have to bring to light and allow patients to talk about it more freely. Yeah.
Now, when we're talking about these PSA tests, how often, my husband and I actually argue about this, and it's probably because I am sensitive because of my grandfather, but I'm telling him he's not even 40 yet, and I'm like, you should probably go get checked. And he argues with me a little bit. But how often and starting at what age should people go get checked?
That's a great question. So screening is encouraged in men who are 55 to 69 years old. And now there's a caveat that in men of African American race or those with a family history of metastatic or lethal prostate, breast, ovarian, or pancreatic cancer, screening may be performed sooner and should be individualized. Now, men who are older than 70 or have a life expectancy less than 10 to 15 years may not benefit as much from routine screening. However, men who are 70 or above and are in excellent health, they do still benefit, and we do screen those men. Again, it becomes a very individualized treatment and screening method that we employ.
You know, I don't want to become tangential with this, but whenever we used to talk about what middle age was, I think people thought 30s, 35, 40, you know, and now we're seeing that change drastically. So when you talk about people that are in their 70s, healthy, they've got far more than that 10 years looking ahead. That's really important because a lot of times I think people start to hit a certain age and they go, I don't need to focus on this anymore. Our life expectancy has changed greatly. It is important.
Absolutely. And I think the thing that I talk to my patients with most is what are we trying to get out of screening for any kind of disease, not just prostate cancer. And it is to be with family longer, to have a good quality of life longer. And because of the life expectancy increasing and the patient's overall health improving with our advanced treatment methods these days, it's important to talk about these problems that in the past we may have pushed to the side.
Mm-hmm. I want to talk about what those advanced treatment options are here in just a moment. But first, let's start with what are the signs and symptoms? What should people be looking for?
That's a great question. So the prostate cancer in its early stages actually doesn't have really many signs or symptoms. However, in advanced stages, patients can start experiencing trouble urinating, decreased urinary stream. Some patients have blood in the semen. Some patients have pelvic pain or discomfort, bone pain, especially in their back. And they may experience also erectile dysfunction. Those are all signs of advanced prostate cancer. But because prostate cancer is somewhat symptomless type of cancer, we do encourage screening in patients that are at highest risk.
Absolutely. Again, that's why it's so important because it's best to catch things early, but it's hard if you don't have those symptoms. So that's why these screenings are absolutely imperative to make sure you don't get to the advanced point before you start to look for treatment.
That's absolutely correct.
So let's talk about the treatments. What does that look like now?
So I always discuss various options with my patients, and I provide all of these options to them. We can do things such as watchful waiting, which means we don't do anything at all. We just watch the cancer and see if it actually is going to affect anything, and depends on the quality of life that the patient has and also their life expectancy. We have things such as active surveillance, where we actively follow the patients with routine, more frequent PSA screenings and physical exams in the office to see if the cancer is actually going to progress rapidly enough to affect them significantly. After that, we talk about definitive treatment options, and that includes things such as radiation therapy, and that can be done as external or internal beam radiation. We can do radical prostatectomy or surgical removal of the prostate, which I specialize in, and I do using robotic technology. We have other investigational protocols such as cryotherapy or high-intensity focused ultrasound, and there's also systemic therapies available for advanced and metastatic disease. So I talk to my patients about all of these options, and we jointly decide on what's best for them.
And what's best for them is going to depend on so many factors. Name a couple of things that you take into consideration whenever you're deciding on the treatment?
Absolutely. So localized prostate cancer that has not spread outside of the prostate as far as we can tell, the best therapy and that gives the patient the longest life expectancy and survival rates is considered to be radical prostatectomy using the robotic technology or robotic-assisted radical prostatectomy. Other treatment options such as radiation therapy, I think, are extremely good in select patients that may not be good surgical candidates. They may not be able to undergo anesthesia or even the surgical procedure itself, and therefore we offer them radiation therapy, which can also have some good lasting prognostic effects. The other treatment protocols that I sometimes discuss with my patients depends on their overall health. So if their life expectancy may not be 10 years, I may offer them to watchful waiting or active surveillance, and we monitor the disease. If it's a low-grade type of prostate cancer, I offer watching it for a little bit longer period of time before we decide on definitive management.
And I just want to ask one more question before we have to cut to break here. But, we're talking a lot about symptoms. We're talking about what happens whenever it's already there. Let's talk for just a minute about preventative measures. What are things people can do to help keep themselves healthy to try to avoid something like this?
Absolutely. So, the rule of thumb with any kind of health condition is eat healthy, exercise, try to be as active as you can be, and watch, get routine screening by your primary care doctors, by your specialists, and you also have to be aware of your family history. So if you have some diseases running in the family, you may want to look a little bit closer at those things. So patients with a family history of prostate cancer, for example, may want to get checked a little bit sooner. And I think using that as a holistic ideology and as a holistic viewpoint, that's going to benefit patients. Unfortunately, there's no good preventative measure for prostate cancer or many other cancers for that matter, but getting checkups routinely by your family doctor or by your specialist, I think, is going to go a long way in catching things early.
And again, basic good health, that diet and exercise is so important, because even if it's not something that you can actually prevent, if you have to go through treatment later, it can help you to feel healthier and get healthier more quickly.
Absolutely.
All right, let's cut to our break now. We will be back again. We're talking with Dr. Shakuri-Rad, and this is your Mon Health Talk Radio on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, call now at 304-296-0041.
We are back. I am Sarah Josie, Dave out, and I have in studio with me right now Dr. Shakuri-Rad, urologist and medical director of robotic surgery at Mon Health Medical Center. We've been talking about men's health. Again, not my area of expertise, but I'm learning a lot, and hopefully a lot of our listeners too, even the men. I think that there's a lot to learn. So we've only got a couple minutes left. I really want to hit on, just for a second, BPH. I'll let you explain what that is.
So BPH is benign prostatic hyperplasia, and it is essentially the enlargement of the prostate gland, which may lead to bothersome symptoms such as urinary frequency and urgency and multiple nighttime awakenings.
All right. And how does this impact men?
It's a significant quality of life issue because of having to seek a bathroom essentially anywhere you are, and anywhere you go, you have to stop the car multiple times, you have to wake up multiple times at night. So it becomes a significant quality of life problem. And
if someone's listening and that's describing them, how can they reach out to you? Or any of these things, whenever we're talking about prostate cancer, anything, how can they reach out to you and find out more?
They can definitely call us at the Mon Health Medical Center Urology Department, or the main number even, or they can even go to my personal website, radroboticsurgery.com, and they can find out a lot more information about all of these issues we talked about today and more.
All right. Thank you so much, Dr. Shakuri-Rad. We are going to now wrap up the show. This was your Mon Health Talk Radio on WAJR.